Hello, and welcome to our listeners around the world. This is the JAMA Editor's Summary, and today is Friday, February 28th, 2025. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. I'm joined today by JAMA Deputy Editor, Dr. Linda Brubaker. Hi, Linda. Let's get started.
Hi, Kirsten. This week, JAMA published an article investigating Sugemalimab for a gastric cancer treatment. Sugemalimab is an anti-programmed death ligand 1, or PD-L1 antibody. Because PD-L1 can prevent the immune system from attacking cancer cells, researchers are interested in the role that PD-L1 antibodies can play in cancer therapy for patients whose tumors express PD-L1. Dr. Zhang and colleagues designed a phase 3 randomized controlled study. They enrolled patients with unresectable, locally advanced, or metastatic gastric or gastroesophageal junction adenocarcinoma. Participants also had to have a PD-L1 combined positive score of 5 or greater, signifying PD-L1 expression. All patients received chemotherapy, and 241 were randomized to Sugemalimab, with the remaining 238 patients assigned to placebo for up to 24 months. Researchers reported that the Sugemalimab group had significantly prolonged overall survival and progression-free survival compared to the placebo group.
Dr. Klempner and colleagues wrote an editorial for this study. They review immune checkpoint inhibitors like anti-PD-1 antibodies and anti-PD-L1 antibodies and talk about their emerging role in treating tumors with higher levels of PD-L1 expression.
Dr. Verrucous and colleagues looked at health-related social spending. They evaluated a program in North Carolina called the Healthy Opportunities Pilots, or HOP program. The HOP program is financed by Medicaid and aims to address health-related social needs like food access and housing. The authors evaluated whether using the HOP program would decrease overall Medicaid spending. The primary outcome was total Medicaid spending on medical and HOP program services per beneficiary per month. They included over 13,000 HOP members and over 73,000 comparison members and found that there was increased spending and enrollment followed by a subsequently lower spending trend.
JAMA also published research letters this week. Dr. Singh and colleagues assessed whether hepatitis C screening increased in pregnant and non-pregnant individuals after new guidelines were published in 2020. They included over 115 million patients from U.S. healthcare organizations. They found that the guidance to test for hepatitis C in all adults and during pregnancy was associated with a statistically significant increase in HCV screening among pregnant versus non-pregnant women, despite decreased population-level HCV screening in 2020.
Dr. Appa and colleagues contributed a research letter in which they studied methamphetamine contamination with fentanyl by evaluating hair samples from 485 participants from Los Angeles. The authors reported that more than 20% of participants who used methamphetamine had a hair sample positive for fentanyl, despite no personal report of fentanyl use.
In another research letter, Dr. Inoue and colleagues wanted to learn more about how the COVID-19 pandemic affected chronic illness. They used NHANES to look at the prevalence of diabetes and glycemic control in over 24,000 individuals from 2013 to 2023. They found that the prevalence of adults with diabetes did not significantly change over this time period, but glycemic control among those with diagnosed disease worsened in 2021, 22, and 23.
There's also a JAMA Viewpoint this week by Dr. Mandel, who discusses the rise of direct-to-consumer health platforms and their interest in artificial intelligence. He calls for collaborations among traditional healthcare organizations, direct-to-consumer companies, and other leaders in healthcare delivery.
JAMA's clinical content this week includes a special communication from Dr. Aaron and colleagues. Clinicians might want to take special note of this manuscript, in which these authors explain recent revisions to the legal standard for medical malpractice from the American Law Institute. There's also a related podcast with this special communications corresponding author, Dr. Christopher Robertson, in conversation with JAMA executive editor, Dr. Gregory Kerfman. Let's listen to a bit of their discussion.
What people have tried to do in this context around medical malpractice is to facilitate physicians expressing regret for a bad outcome without necessarily accepting responsibility or liability for there being any negligence in producing that bad outcome. Because, of course, in a lot of settings, whether it's an emergency room or an oncology clinic, there's going to be a lot of bad outcomes, but of course that doesn't mean that they're due to negligence. So the restatement has tried to clarify that mere statements of regret for an outcome are not admissions of negligence. This goes into a larger effort that the restatement is trying to make room for, which is to break down the sort of adversarialism when a bad outcome happens and instead move towards a problem-solving resolution to make sure that our healthcare systems can actually become safer over time. And the thought is that the bunker mentality where every hospital and physician is sort of denying that anything could ever go wrong is not helpful for making sure that things go right more often.
The clinical challenge this week describes a 25-year-old with a 1-month history of skin lesions. There's also a JAMA patient page on calcific aortic stenosis that reviews risk factors, diagnosis, and when to consider aortic valve replacement.
JAMA Men News this week features an article by Associate Managing Editor Kate Schweitzer. She writes about a JAMA interview with Dr. Schulke, professor of engineering at Brown. They discuss 5 innovative efforts that engineers are considering to counter antimicrobial resistance. She also explains how an engineer's training and mindset can bring unique perspectives to approaching challenges in antimicrobial resistance. You may be interested in the associated podcast. And there is an interview with Associate JAMA Plus AI editor Dr. Swen and Dr. Ortega, a clinical associate professor of medical education at University of Illinois College of Medicine in Chicago. They discuss a framework for incorporating language equity into digital technologies, AI, and medical education.
And so in this techie framework, how do you think we should best start to train our new physicians in terms of ensuring that they are fully competent in these areas?
The number one thing I would say is language appropriate communication is a learnable and teachable skill, and it should come with accountability. So there are 2 pieces of that. One is what are we doing in education, and 2, what are we doing in assessment and confirming those skills. Because currently in medical education in the United States broadly, we really are only teaching and assessing clinical skills in English.
Thanks for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Linda Brubaker and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.